Today, with Travel Secrets Mexico, we have the honor of speaking with Dr. Javier Lopez. He is on the cutting edge of integrative medicine, working with stem cell therapy. Can you tell us a little bit about your experience here at the conference and what you're doing with your practice?
Well, this has been a beautiful opportunity to talk to all the parties involved in medical tourism, where in Mexico, for the last 2 years, we are very active doing stem cell research. Our group, the Regenerative Medicine Institute in Mexico, is based in Tijuana, the Angeles Hospital, one of 22 hospital systems in Mexico, where using strict protocols, we have started a 27 trial program in order to understand better the work that adult stem cells, particularly from adipose tissue, works in this arena. So I've been finding that there's much interest. There are patients from around the world looking for these therapies, and it's been my privilege to talk about legislation, about health law in Mexico regarding stem cell therapies, which is only allowed under strict research protocols.
There's always a political component to work through as part of breaking through in new research and development, isn't there?
Well, these therapies are very much in the initial stages. So scientists and the medical community as a whole needs to be very, very careful on how you approach this. There's trials, there's placebo-controlled trials, double-blinded, and there's more than 400 centers around the world that's doing the research. Of course, we're not the only one. We're probably the last ones that got involved, but we have the privilege to have very important relationship with a research institution in the U.S. and around the world. We're members of 7 clinical research organizations that are sharing the data, and because of recent Mexican law changes regarding stem cell therapy, we are now able to take this and expand the program where patients from all over the world can be part of these trials.
That's excellent. Is there a way, Doctor, if there is a person watching this show from the U.S. or Canada, that they might reach you to do their research and learn a little more about their options and how stem cell research might?
Yes, we have a website where I believe we clearly define our work. There's a lot of misconceptions on what is legal, what is allowed and what isn't. And there in that website, people can read regarding the new Mexican law that was passed on exactly what is legal, what isn't. For instance, most people believe that because we're in Mexico, that embryonic stem cell is allowed, and the fact is that embryonic stem cell therapy under any form, research or treatment is illegal in Mexico. Stem cells that come from animal origin are illegal also. So there's very strict guidelines, and yesterday we had the opportunity to talk to the different medical facilitators that have in the past been bringing patients to Mexico, and now with this new legislation, they know exactly what the boundaries are. I believe they are leaving today knowing exactly what to ask these providers that might not be working within the frame of the law, and that there are programs, very serious programs, that have the approval of international committees, as well as our equivalent of the FDA in Mexico, which is called COFEPRIS. So there's very strict guidelines, and it was something that we welcome, because before then it was kind of gray, and there was a lot of misconceptions regarding that in Mexico you can do whatever you want because there's no oversight, and it's on the contrary. So people are, I hope they're after our presentation yesterday, are going back home understanding that there are laws, that there's an oversight, and there's IRBs, and there's protocols to follow, and that the most important thing is patient safety. So as long as the research is serious and with these guidelines, we can guarantee that patient safety will be at the forefront of these trials.
Well, you have dispelled misinformation just in this brief interview, and that's very, very important that the public understands that there is quality control, there is very serious legislation in place, and that the research is having a profound effect and impact and a lot of success, from what I understand.
Yeah, most. I mean, what the science community is looking for in a trial is that it's oversight, and then the data is published, and that's exactly what we're doing. There's 3 committees that oversee our program. There's 3 databases that are data is directed for evaluation of the individual programs, and then of course the Mexican government, again equivalent of the FDA, which is COFEPRIS oversight. So it's peer review, peer review, peer review, and that is the only way to advance the science of stem cell therapy.
Well, that is fantastic. We appreciate so much the work that you're doing. I know it's a labor of love, and it takes many hours and lots of education in the years past. I'm also very interested in speaking with you further about the use of the pulsed electromagnetic field therapy and how those two worlds are integrating now. A lot going on, very dynamic field, and I really appreciate you taking the time to visit with us today.
And to answer your question, if somebody wants to read more about our work, our website is www.regenerativemedicine.mx, and they'll find
regenerativemedicine.mx,
and that's where you'll find a lot of information on what we're doing.
Fantastic, Doctor.
Thank
Well,
you
I
much.
hope you have some time to relax before you leave our beautiful city.
We will try.
And perhaps we'll see you back in Tijuana or San Diego there soon.